and this is led by Professor Claire Goodman, who's going to lead off the team. So over to you, Claire.
Hello, I'm Claire Goodman. I'm the lead for the Aging and Multimorbidity theme, and with colleagues I'm going to be giving you a flavour of what we have been doing since the ARC started. So the theme so far, really we've focused on collaboration and building networks both within the East of England but also nationally with our counterparts in the 15 ARCs. Aging and multimorbidity affects almost all research and its implementation. So we have our core work around care homes and medication optimization, but we're also really putting a lot of effort into making sure that we are working with other themes and studies that are serving these populations. We're also building relationships both online and face-to-face with groups who historically tend to have people who speak on their behalf. So that's care home residents, with work being led by Anne Killett, people living with dementia, and most recently, carer staff who are working in social care, who are not qualified but are responsible for providing care. We've also taken forward studies that we completed with the ARC and with the Clark before it, and focusing on dissemination and implementation. So I'm just going to look at 4 projects that illustrate the different ways that our theme is supporting research and its implementation. The DACHA study is a study that was, the idea for it was conceived within the ARC, and it was discussed as part of our national care home network, which then, after a series of meetings, led to a bid, which was then funded and has gone forward with 14 co-applicants, including representatives from the care sector, and has representatives from 7 ARCs on the study. The home health study is a trial that is led from UCL, and Hertfordshire is one of the study sites. And again, this is an ARC study primarily because the partner who is giving the intervention, a behavioural intervention tailored to the needs and priorities of older people living at home, is Hert's Independent Living Service. So, and we are very hopeful that if this is successful, then we will be able to demonstrate that here is an intervention that we have already proven can be delivered within the service system. Decision UK is not funded by health or social care, but by the Department of Transport, and it's led by Professor Michael Hornberger at UEA, and this is an ARC study which touches on a really important area of experience for older people, because as studies consistently show, losing the ability to drive affects so much of participation and inclusion in later life. And finally, a smaller project that is wholly ARC funded, which is taking forward our principle of taking the research to existing groups rather than requiring them to come and join us. So this photo here on the right is from Red Shed Dementia, one of our population, based in one of our populations in focus, Stevenage. And they have been working with us to review research ideas, priorities, and going forward on a study that is looking at how to support networks of support both in the community and also in care homes. And finally, from me, this is just to talk a little bit about dissemination implementation. So we're trying different models of how to connect and share evidence and debate it. We had a recent workshop where we brought clinicians and researchers together, researchers who had evidence ready to be implemented but had difficulty getting traction and impact, and clinicians who had particular interests that they wanted to have evidence on, or had completed small projects that they thought could be scaled up and could be applied more widely. And this led to several good discussions and 2 projects that are going forward. We're also interested in how we can connect with people in different ways. And so that picture on the right is a screenshot from a film that Joe Morton has developed for us about consultation work we're doing, explaining to different stakeholders not only what we would like to talk to them about, but also how information from others on the same topic will be brought together. Dementia-friendly communities is building on work that was completed as part of the Clark when we did a national evaluation of dementia-friendly communities. And going forward, we have been involved in roundtable discussions for the Dementia World Council and their briefings on dementia-friendly initiatives. We secured a small grant from the Global Challenges Research Fund to work with Vietnam as they explore different ways of enabling people with dementia to live well in their local communities. And we've also got a targeted project working with 3 dementia-friendly communities that includes Stevenage, looking at how they can enable people with dementia to participate in physical activity. No presentation can avoid COVID, and one of the early things that we were involved in and led was to develop a series of top tips for tricky times in response to questions from staff involved in direct care, using research evidence from people across this arc and Sussex, Surrey and Kent to say, okay, this is what we know is really good to do, which is relevant for the kind of challenges you're facing. And it's had huge uptake with hundreds of downloads being promoted through the 4 devolved nations, translated into Spanish, and we're currently following up to see how they are being used. We've also been invited to provide briefings on care home data for the Cabinet Office and organised a cross-arc consultation on research on visiting that went forward to the SAGE social care subgroup and is now being picked up by the Older People Policy Research Unit. I'm now going to hand over to Crystal. Thank you.
Thank you, Claire. My name is Crystal Wormuth, and I'm a research fellow in the Aging and Multimorbidity theme. I'm going to briefly give you a snapshot of the different research projects and the work that we do involving care homes. So first of all, I want to mention the general practitioner's role in advancing practice in care homes, or the GRAPE study, which is a review that has looked into the evidence of the general practitioner's role in advancing practice and improving care in care homes. We've also been involved in a volunteering in care homes review, which has also been synthesizing the evidence of previous studies and literature so that we have a better idea of the knowledge that's out there about volunteering for older people in care homes, as well as identifying any potential gaps in knowledge which might need further study. As Claire mentioned, we cannot forget about COVID-19 and the pandemic's impact on care homes. It has been huge. We know that it has resulted in people not being allowed or to visit or enter care homes, and the outbreaks and this increased death in care homes. From some of that, we've done a couple of projects that I just want to highlight here. First of all is the video conferencing and online technology for communications between care homes and health and social care providers. As part of this study, we're reviewing previous evidence about using this type of technology with care homes, but we're also interviewing health and social care providers about their experiences using this technology during the pandemic and how it has worked and issues that they have faced, so we can make recommendations moving forward about using this technology with care homes. We've also been involved in the CovePal study, which is led by King's College London, which is looking into how we can improve palliative and hospice care services for people who've been affected by COVID-19. This is a national and international study. We also have been involved in medicine optimization research, specifically in the context of care homes. I just want to highlight 2 studies that are about this. One of them is the Understanding Stakeholders' Perspectives on Implementing Deprescribing in Care Homes, also known as stopping. Deprescribing is the stopping or reducing of medications. In this stopping study, we are looking at how to implement deprescribing safely and well by taking into consideration the views of all the people who are involved in the process of deprescribing in care homes, whether that be GPs, pharmacists, care home staff, all the people who are involved in that process. We also have another study that's looking into informing practice based on previous deprescribing experiences in the care homes independent pharmacist prescribing study, also known as CHIPS. This will be talked about further in the presentation. So I'm just going to allow them to talk about it in greater detail later. I also would like to bring your attention to the other activities that we are doing in the theme with care homes. For example, we are the hub for the Cross-ARC network, which is nested in the National Aging and Dementia theme. As part of this network, we are collaborating and sharing information across the all the ARCs and with people who are interested in care home research. We are not only sharing our knowledge, but then reducing any duplication of research. We are also building bids and developing research. One great example of that was the DACHA study, which came out of collaborations in the network, which Claire's already mentioned that study previously. Also within the theme, we are building capacity, not only within our theme, but also other local clinicians and practitioners. So for example, we have been, our theme member has received a This Institute fellowship, which is looking at care homes and primary care and looking at how that relationship can be improved, taking the learning from the pandemic. We also have a NIHR School for Social Care application on data integration, which has been submitted, and a ARC Clinical Research Fellowship, which is looking at hospital discharges to care homes. This is actually one of the posters that is presented in the e-poster session. So if you'd like to know more about this work, please go to the e-poster session. Thank you for listening and hearing about some of the work that we're doing with care homes. Now I'm going to let Debbie talk to you more about the work that we do about medicine optimization.
So in our theme, there's a strong focus on medicines optimization, which spans both the aging and multimorbidity elements of our theme. We're interested in working with members of the health and social care team and policymakers to develop, test, and implement new ways of working. We've got an expertise in applying behavioural science to achieve practitioner and patient behaviour change. So here's a flavour of some of our current NIHR portfolio projects around practitioner behaviour change to deliver medicines optimisation. So comprehensive geriatrician-led medication review, or CHARMA for short, is an NIHR programme grant for applied research that was developed from a PhD that was jointly funded by the Norfolk and Norwich University Hospital and the University of East Anglia. And this partnership with the stakeholders from the outset was so important to the success of the research. So CHARMA is about testing a hospital practitioner behaviour change intervention to increase proactive deprescribing of medicines. So this is stopping medicines where the likelihood of harm outweighs chances of benefit before any harm actually occurs. And CHARMA is led by the University of East Anglia and Norfolk and Norwich University Hospital, working together with Addenbrooke's Hospital in Cambridge, as well as universities in Newcastle, York and Leeds.
Medicines optimization in care home is historically challenging, and in my practice as a pharmacist, I know that something that would really help this is if there was one person who went into care homes and assumed overall responsibility for medicines. And the Care Homes Independent Prescribing Pharmacist Study, CHIPS, did exactly this. So CHIPS evaluated the impact of putting pharmacist independent prescribers into care homes to assume overall responsibility for all aspects of medicines optimization in this setting. And the trial process evaluation identified that one of the interventions that pharmacists did very frequently in some care homes was proactive deprescribing. So that's this idea of stopping medicines before harm occurs, rather than waiting for a patient to have a side effect or another harm and stopping it in response to that. However, there were other care homes where we didn't see very much proactive deprescribing, even though they all got the same CHIPS intervention. So there must be something about those care homes where we saw lots of proactive deprescribing that the other care homes didn't have. We've now been given further funding by the NIHR's Translating Research into Policy scheme for us to explore this variation in practice, specifically to identify the enablers that were present in the care homes that pharmacists were achieving higher levels of proactive deprescribing in, and also to go to those care homes where we didn't see very much proactive deprescribing and finding out what the barriers were. Using behavioural science, what we then want to do is bring together key stakeholders, so people who work in care homes, other primary care healthcare professionals, and importantly, local and national policymakers to put together guidance and policy to support adoption of proactive deprescribing in care homes nationally.
My name is Kumud, and I'm a Senior Research Associate in the Aging and Multimorbidity theme based at the University of East Anglia. My experience of working in NHS hospitals as a cancer services pharmacist for over 15 years led me to realize that when people finish their cancer treatment, it was not the end of their cancer journey. Many people will go on to have problems related to their cancer treatment for years after they finish treatment, and need help to manage these long-term problems by themselves. I am working on the DISCO project, which aims to develop an intervention for practitioners in primary care to support older cancer survivors to self-manage long-term problems related to cancer treatment. We have surveyed over 300 cancer survivors to understand what their physical, emotional, and social needs might be. We have also completed a realist review to understand what works for whom and in what circumstances in relation to practitioners engaging older people in discussions about self-management. We are currently working with patients, practitioners, and commissioners to co-design the intervention.
So as well as ongoing research projects, our theme is also working on implementation projects, and here are a couple of examples. Mazda is a portfolio study that has led to the development of an algorithm for guiding practitioners, patients and carers in selecting the most appropriate interventions to support a patient in taking their medicines as prescribed. And this Mazda, the medication adherence support decision aid, has been implemented to guide practice in some community pharmacies, and now we're working towards it also being embedded in hospital and general practice policy. We also had an NIHR Clark funded study to establish good practice in opioid tapering services nationally and internationally, and we combined that data to generate the opioid toolkit, and we're now working with key stakeholders to support its implementation into practice.